Hi, I'm Daniel, Clinical Lead at Treated. Sandrena is an estrogen-only gel for women going through menopause. It helps you manage the symptoms of menopause like hot flushes, vaginal dryness, insomnia, mood changes. It contains the active ingredient estradiol. It works by increasing your estrogen levels and improves your symptoms. You can use Sandrena continuously or cyclically with progesterone. If you're on combined HRT, you can start using Sandrena whenever you want. Whereas if you're on sequential HRT, start Sandrena after you finish your current cycle. You'll usually start on a lower dose first. You should apply it once a day, preferably on your thigh, making sure you switch sides with every application. It usually takes a few weeks for HRT to start working, but you should wait 3 months to see the full benefits before thinking about changing your dose. You can get Sandrena online with us. We've helped thousands of women get the HRT they need. You'll get the treatment that suits you best, alongside ongoing support from our experts.